Okay, guys, how are you? How are you doing? Today, I want to read the facial policy guidelines from the Green Book as well. It's very important as well, and it's very common. A clinical exam, it comes up in the video, in a video station mainly, I guess, in the clinical immersive research exams, and it could be a com as well. It could come up as a history with underlying disease, for example, in association with GBS, which is Guillain-Barré syndrome, for example. So it's very, very crucial and important even for your daily practice. You will face a patient with facial palsy on your daily practice. So let's start together reading that. So how you can recognize a facial palsy. So in definition, we have the Bell's palsy, which is idiopathic lower motor neuron facial nerve palsy. So it's just idiopathic, there's no reason for that. You have to exclude secondary causes of facial nerve palsy, whether it's due to infection or inflammation, tumor, trauma, or vascular event clinically, and or with appropriate investigations. So you have to put all this in mind. It could be idiopathic, it could be due to infection, inflammation, tumor or trauma or vascular event. So what's the symptoms and signs of facial palsy? So first of all, you will notice that there is asymmetrical facial expressions, asymmetry of the face or a smile, and loss of the nasolabial fold on the same side of the affected side, demonstrable weakness in lower motor neuron distribution includes loss of wrinkles on the forehead. So all that is going to be obvious for you, just if you take your time in observation. Observation is a very golden element in here. So don't rush just to examine the facial nerve. Just take your time observing the patient. Increased or decreased lacrimation as well. Hyperacusis, he will be sensitive for loud noises, even for your normal tone of speech. Altered taste as well in the anterior third of the tongue. He may experience facial pain as well, difficulty in closing eye as well. So what are the points you have to ask about it in the history in here? So history of prior viral infection may be present, abrupt onset with no progression, no history of preceding seizure or head injury, no history of preceding seizures or head injury. So these are elements you have to keep in mind, which is again a previous viral infection. It's sudden in onset and no progression. It's just happened. That's it. There's no any progression. It doesn't get worse over time. No history of preceding. Seizure or head injury. On examination, you will focus on full neurological examination, basically, including other cranial nerves and fundoscopy as well. You will have a look on the ears, nose, and throat to exclude cholesteatoma, mastoiditis, or herpes infection. This stuff may predispose for facial palsy. Blood pressure to exclude hypertension as well. Check for lymphadenopathy, hepatosplenomegaly, pallor or bruising to exclude malignancy. Some patients in pediatric age with leukemia, they presented only with facial palsy as a first presentation. So you have to keep all this in mind, guys. So that's for neurological examination, you will explore and examine other cranial nerves, and you do fundoscopy as well. You will do ENT examination as well, checking for cholesteatoma, mastoiditis, or herpes infection. Blood pressure measurement is crucial in here. Look for lymph nodes, hepatosplenomegaly, pallor, and bruises for malignancy. What investigation you should do in here? If all history or examination unremarkable and no other neurological signs or symptoms, no investigations needed. So if your examination and history is all clear, you don't have any clue to guide you for the specific diagnosis or underlying cause, so you will need to do no need for any investigations in here. If there is a difficulty in closing the eye, so you have to refer him to the ophthalmology for ophthalmological assessment and referral. If there is a bilateral facial palsy, consider Lyme disease in your mind, Guillain-Barré syndrome, brainstem pathology. Discuss further investigations with consultant with a special interest in neurology or tertiary pediatric neurologist. So in here, it depends whether you have unilateral facial palsy or bilateral facial palsy. If you got bilateral facial palsy, you put the Lyme disease in mind, Guillain-Barré syndrome, and brainstem pathology, which is brainstem tumor, cerebellar tumor, whatever. You have to put all the pieces together. Recurrent facial palsy, discuss with the senior. If there's a recurrent, it's on and off. So you have to discuss with your senior. Recurrent infections, first line immune deficiency investigations, including HIV. Okay, so if there was a recurrent infections, so you have to think about the immune deficiency. You will do first line immune deficiency investigations, including HIV. Don't forget HIV in here. Severe pain associated with varicella zoster. If there's a severe pain associated with varicella zoster as well, you will find the vesicles following only one dermatome, so that will be obvious for you. So in here, what you're gonna do as immediate treatment in this situation, if difficulty in closing eye, you will provide eye patch and carbomer ointment, which is emollient for the eyes to prevent the dryness of the cornea and to prevent the development of keratitis, which is painful and may cause blindness. If vesicles suggest herpes simplex virus, prescribe acyclovir orally. Within 72 hours, prednisolone 1 milligram per kg per day for 5 to 7 days can be given as peer adult practice. Of course, you will discuss that with your senior. You will not do it by yourself or decide by yourself. So in here we have the eye issue in here. We have the underlying cause. If you have find any herpes simplex virus vesicles, and this is the underlying cause, so you will prescribe acyclovir orally. You will think about giving the prednisolone within 72 hours after the presentation, within 72 hours. Okay, then discharge and follow up. So after discharge of facial palsy patient, you will guide him or advise him to go for GB follow-up for weekly. So that's every 4 weeks he will go for a follow-up with his GB until symptoms and signs resolve 95% by 1 year. So facial palsy symptoms will take up to 1 year to resolve by 95%. So after discharge, he will go and follow up with his GB every 4 weeks. Okay. If facial palsy doesn't improve considerably within 4 weeks, arrange a cranial imaging MRI brain with request to focus on brain stem. So in here, if the facial palsy did not show any signs of improvement, or even little signs of improvement within 4 weeks, so in this situation, you will think about arranging a cranial imaging MRI for the brain, with request to focus on the brainstem area, which is the area where the facial nerve nucleus comes out of the brainstem, and it's the origin of the facial nerve pathway. Maybe you may find a tumor or a mass compressing the nerve over there. If any other neurological signs or symptoms, consider early immediate imaging. Okay, so that's all. It's only one page, facial palsy guidelines. Doctors, I wish you enjoyed it. I wish you get benefit from this. It's very important even for theory exams as well. I wish you enjoy it, and thank you for watching. Bye bye.